I want to welcome everyone to the Kenosha County Substance Abuse Coalition quarterly meeting. I'm Karen Van Heinigen, one of the co-chairs, along with Guida Brown from the Hope Council, who's another co-chair. And we're excited to have you all here today. In lieu of our normal quarterly meeting, we will be having a trainer, a speaker, Mike McGowan here. This is a part one of kind of a two-part training series that we'll be offering. The next one will be at our next quarterly meeting, which is August 9th from 10 to 11. So if you're interested in hearing more from Mike, he will be joining us again on August 9th. We'd love to have you. This is being recorded. If you like this presentation and want to hear it again, or if you hear it and love it and want your coworkers or other people to hear it, you will be able to access that through a recording that we can make available to you. If you don't already have our contact information, I want to just let you know about our website that we have through the coalition, which is saveliveskenosha.org. It's got tons of information on everything substance use disorders in Kenosha, and I can help you navigate any information you might need, and you can also figure out how to contact us on there if you want to get on our mailing list or whatever. Then I just want to move on and introduce our speaker here so he can get started. We are very excited to have Mike. Mike is our go-to speaker for all kinds of things related to substance abuse, super knowledgeable and so wonderful to listen to talk. If you haven't heard him already, you're in for a treat, and I'm sure you will really enjoy your time listening to him and hearing what he has to offer. So, Mike, if you can take us off on this very important and critical topic of stigma, that'd be great.
Okay. Well, that was a little serious, that part. Well, welcome and thanks for inviting me. It's hard. I'm not good with names. I'm great with faces, but I'm terrible with names. So I'm looking at all your names, and I recognize a couple that I know. But if I've met you, hello. If I haven't, nice to meet you. Guida and Karen asked me to do this a while back. Oh, here's the bad part. Karen just said this part 2 is in August. If nobody shows up in August, I guess this will really stunk today. So you got to show up, right? And we started talking about this. This is an ongoing conversation that Karen and Guida and I have had for quite a while about how we talk to each other, how we work with each other, the language that we use around substance use disorders, and how important that is because it dictates the sort of treatment and the sort of care that an individual gets. Not only that, but the public perception with it. And the question that we have, or I have as we start, is, are we on the same page? Now, for those of you who know me, then this is going to seem a little boring, but for those of you that don't, I don't know how you get to do this, what I'm doing today, but it's a long journey. Every now and then I'm presenting to a place and the young person walks up to me and goes, I want to do what you're doing. I'm like, oh, that's great. That's terrific. Well, how do I do that? I'm like, well, first, go to college, right? Second, get a job. Third, work for a long time. And so that when you actually present, you know what you're talking about. I didn't foresee that would be what I was doing decades ago. It just kind of, like many of your careers, I'm sure, it just kind of evolved. So the short version is I've worked as a teacher. I've worked as a youth care worker. I've worked in 4 prisons. I went back and got my advanced degree in marriage and family therapy. So I did that, loved that job. And in that job, we ran into some of this. I wanted to take classes in addiction, intervention, substance use, chemicals, and my boss wanted me to take workshops in Gestalt therapy. And I'm like, well, okay, I didn't see where that was that germane. What I found is the more confident that I got in talking about substance use disorders, the more effective I was as a counselor and a therapist. It's fascinating to me now to listen to how people avoid topics that they don't feel comfortable about. I'm in a lot of places, and I think that there's a lot of professionals that avoid topics that they think might take them down an area where they might look a little bit dumb. And I don't mind looking dumb. In fact, I actually enjoy it, especially when working with a client. Because if they say something, well, you've heard of blank blank, and I'm like, oh no, what is that? Even if I've heard of it, I love going, no, what is that? Because I want to know what they know, how they present it, what they say about it. I remember having a long discussion about 10 years ago with a young man who insisted that he didn't even know what marijuana looked like. And then we got onto a discussion, and he proceeded in about 7 minutes to tell me about different strains of sativa and what they would do to you and where to get access to stuff and what to do. And then all of a sudden he realized what he'd done. And I went, well, yeah, but I still don't use the stuff. I'm like, yeah, right. Because you know a ton about something that you have no interest in whatsoever, right? And then it's how we talk to one another too. I went back a third time to college because why not? And got a degree in management so that I could facilitate programs, because that boss I had in my family therapy wasn't real effective. And so I ran programs, and I would still be doing it today. Now, some of you know this very, very well. One of the programs, well, I ended up becoming president of an addiction hospital and mental health hospital. Two of them, as a matter of fact, neither of which are still in existence. I was a fantastic manager. I just drove them right into the ground. One of them is a condominium project right now. There you go. No, insurance reimbursement got more difficult. All of a sudden, instead of getting 30 days with the patient, all of a sudden you were told you got 3. Thank you very much. What are you supposed to do in 3 days? They're not even detoxed at that point. So I started my own business, and now I train. Next week, I'm training for the Department of Corrections. I train for the Wisconsin child welfare system. So I'm doing training for social workers and therapists. And I'm in schools doing prevention and education work. So everywhere that I go, this topic comes up. And the reason I did that is I wanted to start it this way. I want you to listen. If you've heard me before, you know that I illustrate points by telling stories because I was a history teacher, and I think people remember that, or at least I do. Now, I want you to think along with me, okay? There's a school that I work with on a regular basis where I got called 3 weeks ago. Now, this is recent. This is 3 weeks old. And the principal of the high school said, we have an issue, and you're the expert on this, which made me feel great. She said, we just busted, hear the term? We just busted a kid with weed, cocaine, and a scale, as well as baggies and whatever. I said, oh, wow. And I said, what do you need my help with? And she said, well, we don't know how to proceed. Like, where would you recommend that we proceed? And I said, well, how old is the kid? And she said, 18. He's an adult. Okay. He's a senior. It's 3 weeks from 3 or 4 weeks from graduation. I said, all right. Now, I want you to think about what happens next, right? Many of you have kids. Many of you have had kids in schools. Some of you work in the schools. What do you think would happen next? Right? So I said, my first question was, did you call the police? Because having drugs on school grounds is a violation of both policy and as well as law. And in fact, the penalties are greater. And she said, we did. Okay, I'm stopping there. So the police, what do you think I'm going to say? Told the principal, yeah, we really don't want to mess up his life, so we're not going to follow through. Okay. Now you have the school that busted a kid with drugs on school grounds with baggies and a scale. And everyone, I think, in this room understands the implications of that, right? This isn't somebody who's got Crohn's disease using medically assisted marijuana. This is somebody who's clearly selling. And I said, whoa. And the principal said, should we mandate an assessment? I'm like, well, is he done? She goes, yes, we're moving towards expulsion. And he's a senior. I'm like, well, then why would you mandate he has an assessment other than it might help he and his family? And I said, you can recommend to the family that they do an assessment because that might help them as they move forward. And she said, well, do you think we should allow him to walk at graduation? And I said, well, that's not for me to say, but you do set a precedent if you do that, right? And it's totally up to you how you perceive that. And she was telling me that she was getting pressure from all sides. You can imagine, right? This is coming out of COVID, really what she needs to do with going into graduation is people saying, oh, it's been harsh enough, the poor baby. And then other people saying, slam the door, lock him up, this is a predator or whatever. And she was getting both sides, right? Because that's the sides who normally make phone calls. And so they recommended an assessment. And what they found out was that there was no place within 2 hours of this school that did an in-person assessment. So the family would have to drive 2 hours to get an assessment in person. So they signed up for a Zoom assessment like we're doing here today. Now, some of you may have done these before. I used to do assessments all the time. And personally, I enjoyed it. But what I really enjoyed about it was looking the person in the eye, talking to them about what's going on in their life, and then making recommendations of what I thought that they could do. I routinely used to, when I was young, I started like this. I would try to be so precise. I would say, because the question everybody would ask, everyone, am I an alcoholic? And I would say, well, according to the data of the assessment, it shows that you're episodically abusive of the chemical, and that if you continue using in the same pattern, you will certainly develop dependency later on. And I felt, that was like, and then all of a sudden the county social workers would call me back and say, what in the heck did you do? I'm like, what do you mean? You told her she didn't have a problem? Whoa, no. But that's what the individual heard me say because they asked me a specific question. Am I addicted? And I answered it, not yet. And so then I began changing the way I talked to them. And I used to say, they would say, so am I an alcoholic? I would say, I have no clue. You have a problem with chemicals. Here are the areas in your life that chemicals are causing you a problem. And here's what I believe you could do about it. I like that. And they would come back to, yeah, but am I addicted? I said, you're not listening to me. Listen to me. You have a problem with chemicals, with drinking, whatever. Here are the areas in your life where it's clearly an issue for you, a problem. Here's what I think you could do about it. Yeah, but I'm like, okay. One of my recommendations is you go to these meeting things. And when you go to these meetings, people are going to stand up because it's like a cult. And they're going to introduce themselves, and they're going to say, hi, I'm Maria and I'm an alcoholic. And it's up to you how you introduce yourself at that point. People introduce themselves all sorts of ways, and it'll be up to you. And then you work the steps, whatever. But I think that that's what you could do about it. Now, this is long, long ago that I began doing it, and I'm still doing it that way. Here's where it causes you an issue. Here's what I think you could do about it. Where they are on the grading system, it doesn't really matter, right? It doesn't really matter, except if we're talking about medically assisted treatment. The principal and the superintendent then were confused of what to do. So I said, well, call the district attorney. Don't call the police department. Call the district attorney in your county and say, we're now confused. What do you want us to do moving forward if we catch somebody with drugs on school grounds? And the district attorney said, yeah, I got no clue. Okay, now, the reason I'm mentioning this is these are all professionals, right? The police officer is a professional. The school are professionals. The district attorney is a professional. When the assessor is a professional, when I talked to the kid, because I went to the district and I went to the kid's home and I talked to the kid, and he had just done the Zoom assessment. And I looked at him and I said, were you honest? And he just went. He gave me the Cheshire cat grin, right? And I said, did he ask to speak with your mother or the school or me or anyone? Did he ask for any collateral information? Because what do we know about this disease? Uh, and he goes, no. He just said, I seem like a nice kid and I made a mistake and don't make another one. And this is the professional that's doing a chemical assessment on him. Heck, you don't ask for collateral information. I don't know about you, but I now, every time I go to the doctor, I've got to fill out computer forms every single time. I got to do the same checklist every single time. I got to talk about my great grandparents. You know what they've had in their heads. Heck, every time I go to the doctor, no matter what, if I'm going for a sinus infection, they put me on a scale, and then they give me a readout and a little handout about body mass, like I really care. But you know, it's one of those things that we're not always on the same page, and that's where I want to start with this, because it's important that we get on the same page when we're talking about this. Words matter. Some of you know that I've been doing podcasts for the coalition, and I've enjoyed them a lot. I mean, it's been really fun to talk to people. I see there's a couple of you in here, I think, that I even interviewed on the podcast. And if anybody's interested, we're taking requests for guests. And on the podcast, which have had recovering folks, physicians, psychiatrists, psychologists, therapists, moms, dads, brothers, sisters, young people, I've heard a variety of phrases used. I was going over these in preparation for this, and I was listening to a couple of them. And I'm sure I skipped some, but I've heard user, abuser, alcoholic, drunk, alky, addict, lush, somebody used, boozer, booze hound, speed freak, and of course, the ever popular friend of Bill W. Now, do we call people with diabetes sugar freaks? That's an interesting question, isn't it? How do we refer to them? It's one thing to colloquial speak in slang terms to a group of people who are standing around at the end of an AA meeting. I get that. We all get that. That's not a problem. When I talk to my best friends, when I go golfing with my friends, we speak in Caddyshack language, if that makes any sense to any of you. I've never done that in a training in my life. I would never be hired again. But when we speak about them on all of those terms, and I bet all of those terms seem familiar to you, they have consequences in everyday life. I want to bring up a couple of examples where we've made some significant impact and changes with it. Look at what we've done with brain disorders, right? We have days for them now, right? We have ribbons for them. It's not that long ago, seriously, it's not that long ago, where we would say things like, oh, he's autistic. And now we say, oh, he's a person with autism. He has a condition that is being treated. And this has a huge impact. I was speaking at a grade school, and at the grade school I was speaking at, I asked the kid, they were asking me to talk about bullying, and I never mentioned that word, but it's like mean and nice. And I said, would you ever pick on a student in a wheelchair? And of course, all these fifth graders are like, no. Okay, would you ever pick on somebody who's got the metal crutches and the braces on their legs? And they're like, no. And I said, well, there are other things that happen that we can't see. There are conditions in the brain. There are conditions like Asperger's and autism and learning challenges. And the minute I said that, a young man in the back perks up and he goes, I have autism. And the teacher's in back of him. And she mouthed to me, she went like this, he's never said that, which is an invitation for me to go, oh, what is that like? And he began to explain what he goes through on a daily basis with both noise, proximity, or all of the different things that bother him and how he goes off on a tangent or whatever. And all of a sudden I look and there's a little girl in front. Her name was Katie, and she's crying. And I said, Katie, are you okay? And she goes, no, I'm not. I feel terrible. And she turned and looked at this boy and she goes, I am so sorry. I didn't know this was you. I didn't know it was a thing. I just thought you were weird. And I couldn't speak for a moment. And she goes, I am so sorry. And he goes, thanks. You know, she then went around, because there were 2 other 5th grade classes that weren't in there, and told the other 5th graders, stop it. It's a thing. Now, the reason I like that is because the minute that she, as a 5th grader, what are they, 10, 11? Mine were 13 and 14, but that's near. The minute that she understood that it was something that he,
1299.7.
that he had a condition, it changed the way they began speaking about it. Make sense? Most of us, long ago, with people with learning challenges, stopped using the R word. In fact, now when we hear that word, we're offended. And most of us speak up when we hear somebody saying that word. There's campaigns in the schools I go, get the R out, right? They want people to understand what that person is going through. Why is that important? Well, studies show that how we view this disease of substance use disorders affects whether our reaction to that person is empathetic or you did it to yourself. You just have consequences to pay. And that dictates how they're viewed medically and therapeutically. Even referring to the person with as somebody with substance use disorder as opposed to substance abuser. Oh, she's a substance abuser. She did it to herself. That's the vernacular. She's a person with substance use disorder, or she has a condition, right? How do we treat her? Think about many of us as you signed on. I saw some of your faces, so I know that some of you are around my ballpark in age, right? Others of you are much younger, and the heck with you. But some of us can remember, pull yourself up by the bootstraps, deal with it. You're morally corrupt. You're just weak, right? This is how this disorder has been historically viewed. And it's not that long ago, okay, that some of you will recall that when somebody had a substance use disorder, they were put in a sanitarium to go for the cure, right? It's not that long ago. And sometimes we rock it. I think we've made progress, and then all of a sudden we rock it back there. Even in my own family, here's another story coming. This is so good. As some of you know, because you know me, we had a problem in our family. This disease affected my family. If you do a genogram of my family and you put substance use disorder as one of the colors, let's say you put it in red, our family history just bleeds red, right? Every now and then there's a blue blip of somebody who avoided it, but it's just there. My dad had 6 brothers and sisters. There were 7 of them. Of the 7 of them, 5 had it, including my dad. My mom had it, as some of you know. And so I got together, this is a while back, I got together at a family reunion, right? Don't ask me why, I don't know. And so we're gathered around this big restaurant. And of course, because of the disorder, for those of you who are aware, in Milwaukee, it was at Miss Katie's Diner, right? And there's not much diner, but it's a bar, right? It's a nice place. It's a place. Bill Clinton went there when he was president. So there you go. And for those of you who are younger, Bill Clinton was a president in the 19. And so we're all sitting around, and there's probably 30 of us. And my cousin Vic's sitting right across from me. And he goes, "Hey, Mike, your dad tells me you just got a big promotion." I looked at my dad. Well, that's as close as he got to ever saying he was proud, right? And I'm like, wow. I said, "Yeah, I did." And Vic goes, "Ah, terrific. Congratulations." I said, "Thank you very much." He goes, but I don't know what you do. I love that. I love that. The only part of the story that was left out when my dad told it was what I do for a living. I thought it was great. I looked at Vic, and by the way, when he said, "I don't know what you do," everyone at the table got quiet. For those of you who remember, it's like the old E.F. Hutton commercial where everybody leans in. Now this is 9:30 in the morning. Everybody, almost everybody, has got either a beer or a brandy old fashioned in their hands. And I said, "Well, Vic, I'm president of a drug and alcohol and mental health hospital." You'd have thought I killed the Pope. There was dead silence. Like, no, everyone looked away. It was as though I said, "Let us pray," because everyone looked down, except for my Aunt Virginia. She was awesome. She goes, "Well, I didn't know that. What the hell? Why aren't you helping Eddie then, for Christ's sake?" Um, and I just burst out laughing, and she broke the tension. But we moved on. Nobody ever addressed it again. Oh, except when they had a problem with somebody in their family. And then I would get the clandestine phone call. You with me? I got the clandestine phone call. It's almost like they were covering, "Hi, is this Mike?" They're covering the receiver and disguising their voice. "I wonder what you could tell me to do, with so and so." Now, is that what we do with other diseases? Or do we then post on, "Hey, we went to the doctor. This is what we experienced. Anybody else experience this? What are you all doing about it?" No, we keep this secretive. When my father finally passed away, that sounded bad. When he passed away, my uncle looked at me and said, "I'll help you with the funeral." I'm like, "Well, thank goodness, because I don't know how to do it." He went with me to the funeral home. And when the funeral director said, "Cause of death," my uncle squeezed my arm so hard, I thought he was going to leave bruises, because he thought that I would say he died of his drinking, which he did. He died on a bar stool, right? And my uncle goes, "Oh, aortic aneurysm. It runs in our family." And I looked at him like, "No, it doesn't." Well, maybe it does among those people that drink like fish, right? But it's like, no, this is part of the disease. You don't have it. I don't have it, right? That's a part of it. Uh, and I just want to be provocative here just a little bit. I'm waiting to scroll through the obituaries and read, "She passed away after a heroic battle with substance use disorder." Right? I hear that about almost every other disease. She battled arthritis for her entire life. And, it's like, well, okay, what do? We bury it, because there's still a moral implication around it. And that's part of what we're talking about today, is changing that vernacular a little bit. Now, if you think it's just my family, go ahead, but it's not. There's a review, many reviews. There's been tons of studies about this since the year 2000. So we're not talking about the old days. And it examined how stigma held by us, health professionals, affected the healthcare delivery system. And what the studies have pretty much uniformly found out is that healthcare professionals typically hold really negative views about people with substance use disorder. They see them as manipulative, violent, poorly motivated, and this serves as an obstruction to them getting healthcare. It also points out in many of the studies that healthcare professionals, including us, have very poor and limited training and education when it comes to this disease we're talking about. Now, I started by telling you a little bit about my background. This is part of the story that I tell when I normally introduce myself. So those of you who've heard me have heard this probably 6, 7 times. But when I went to graduate school, I'd already worked in the prison system, right? I'd already worked with people. And so I'm going to graduate with a degree in family therapy. And I kept waiting through graduate school for them to bring this topic up. And they did not. In 2 years of graduate school, substance use disorders did not come up once. Actually, I think I had to take a class, Problems in the 20th Century, where it came up some, but it didn't talk about therapeutically anything. And finally, it got to one point where I raised my hand and I said, what therapeutic technique would you use with a family that had alcoholism? And the professor laughed and said, we don't work with alcoholics. That was the term he used as a professor. This was at Loyola. I raised my hand again and I said, excuse me, sir, I live in Wisconsin. And the entire class laughed. And the professor didn't. I'm like, well, okay, I'm not getting this. I don't understand. I mean, I wasn't being snarky. I didn't get it because I was really concerned. The training I'm going to do with the Department of Corrections people, one of the statistics that I will tell them is that 75% of the people in the correctional system have a substance use disorder. That's according to studies. Now, I can already tell you what's going to happen because I've done this training numerous times. They're going to look around in the room and they're going to go, who's got the other 25%? In other words, even though I give them the data and 75% seems unbelievably high, they're telling me that's underrelated. They're telling me everybody has it. And how do we treat it? Do we do it at all? What education is there? Do you know how many hoops that you have to jump through in the correctional system to be able to get help for your substance use disorder before you get out of jail, before you get out of prison? How you have to prove to them that you're worthy of going to a drug treatment facility and getting education? Now, this is me. This is my own bias. I'm like, why don't we put everybody in there? Mandate it. And people go, well, you got, and think of how this goes. Well, see how we talk about it? You know, have they hit rock bottom? If they're not going to want help, it's not going to help them. You can't help somebody that's not going to want help, right? Okay, does that not apply to almost every other disease as we go there? Do we wait for somebody with cancer to hit rock bottom before we treat them? Or do we try to catch it in the early stages so that we can be more effective in what it is that we do? Do we try to diagnose stuff and give them early interventions because we know the success rate is greater? No, we wait with substance use disorders until the person is so low that it makes it difficult to climb back out of that hole. So it's important that we begin to talk about it. And it's important that we begin to see it. It even goes, it goes further than that. Let's talk for a minute about opiates, if it's okay. Because I think that this illustrates it to me almost as well as anything else. When most people in recovery, while most people in recovery understand medically assisted treatment, because if they have an opiate disorder, they get it, right? I consistently hear in my conversations, not just on my podcast, but in the professional work I do, from professionals, the following: a drug is a drug is a drug. I hear that over and over again. Now, that's not just from the people who go to 12-step meetings, right? They are going to hear it from some of those. Although most people are more educated, they're still going to hear that. I cannot tell you over the years how many conversations I've had with professionals like us who will have misinformation or ask me questions. Like, here's a couple I get. Can't you become addicted to methadone? And that's the way it's asked, by the way. That's the way it's asked. And I'm like, or I have a client who's abusing Suboxone. Well, these are chemicals that can be used off script, of course, but they are critically important for some clients, patients, individuals, in assisting them to live a normal life. It blocks the high that they were getting from their opiate. It maintains a level that they can work at. When I tell people in a training that I know individuals who have been on a methadone for years, they give me this look. Why don't they get off of it? Do we do that with a diabetic? Why don't you just get off your insulin? You've been on it for how long? Right? We don't ask that. Now, could they? I suppose. But somebody who's being treated by a medical professional and is actually following the advice of the medical professional and they're leading a fairly decent life and they're happy with it, where's the issue with that? I think I know somebody who abuses Suboxone. So do I. I know somebody who uses methadone off scripts. So do you. I also know somebody who takes too many bump, right? And I know diabetics who don't follow the specific diet that they should. I know people who have arthritis that don't always address their inflammation. It's part and parcel of the disease we're talking about. And while these drugs can be taken off script, oftentimes they're not. I had a person I was talking to the other day who had just had hip replacement surgery, which I know a little something about. This is a recovering person. And the people at their meeting had them so scared that they would relapse that they forbid the medical staff to give them any painkillers following the surgery. And I'm like, you can follow the doctor's advice and then you won't need them for much longer, Yeah, but I was so scared. I didn't want to relapse. I didn't want to count it. I didn't want to have to start counting my days over. I'm like, okay, every time you have surgery, you don't have to start counting your recovery date as a different date. And then I said, how did it feel when you stood up? And he looked at me and goes, well, that wasn't pretty. I'm like, what was it? And you did that on purpose to yourself. I think all of us would agree that an individual has a better shot of long-term recovery if the economic and social infrastructure is set up to assist them as well, right? Now, this is another area where stigma, I think, hurts a tremendous amount. Most people do not support that type of assistance for people with substance use disorder in the same way they support that kind of assistance for people with other diseases and issues. They just don't. Try to open a recovery facility in your neighborhood and see what happens. People will show up at the hearings, right? Because they're afraid of. What are they afraid of? Now, I'm asking you, I pause sometimes because I want you to think in your own heads, because this is part of the discussion. And if you said crime, assault, then what we've done is we're realizing how ingrained some of these perceptions are in the association with people with substance use disorders. I had a kid that I was working with, and I was so proud of him. After he went through treatment twice, I thought the second time was a really good opportunity for him to live in an assisted living facility, a halfway house, for lack of a better term. And he was doing great. He was going to the public high school, and he became interested in one of the young women at the high school, and she became interested in him, and they began to see each other. And then he showed up to her house to pick her up for a date. And her mom had gotten wind of what he had done and gone through. And when he showed up, she marched him into the living room and kept her daughter in the room. And she said, I want you to stop seeing my daughter. I don't want you ever on my property again. You people aren't welcome here. This is how we relayed the conversation. And he goes, what people are that? Like juniors in high school? And she goes, no, druggies. And he laughed. And this is the way he handled it. I was so proud of him. He said, he looked at her and said, ma'am, I know you don't know me, but I've now been sober 6.5 months. I haven't had anything in my system other than Gatorade in a half a year. Can you say that about the other boys that will come and date your daughter? That was the best line ever. He said, I'll respect your wishes, but I just want to tell you that part of the program that I'm working is rigorous honesty and compassion. So I care enough about your daughter to not create a ruckus. That's my word. That probably wasn't his. And I'm going to leave. Now, he told me this after I got a phone call from the mom. And the mom out of the blue calls me, identifies herself, and says, I want to know what sort of things people go through. I'm like, why, do you have a problem in your family? She goes, no, my daughter is dating somebody that you worked with. And I knew immediately who it was when she said that. And I'm like, I started laughing. I said, what do you want to know? She goes, well, I said, he's a good kid. She goes, but will he bring drugs into my house? I said, well, he better not. I said, I don't think so. But I said, ma'am, it's like any other disease. You can't guarantee what will happen down the line, right? But right now, he's seeing therapists when he's supposed to. He's doing exactly what he's supposed to do. He's following a program. And I said, it's like lifting weights. You get into the gym 3, 4, 5 times a week, whatever, and you keep it up over time. You get stronger and stronger and stronger. That's where he's at. And I can't tell you what he's going to be like at 20 or 25. But right now, he's a pretty cool kid. And she goes, I did him a huge disservice. Now, see, his conversation with her had bothered her so much that she called me, which I thought was great. She ended up calling me, and then I called him and I said, what's going on? And he told me the story, and I said, way to go. Good for you. Way to handle it appropriately. And he goes, I think I'm trainable. I said, well, clearly, right? A couple weeks later, she called and asked if she could see me. And I'm like, oh man, what is this? And she showed up and she said, is there any way that I could volunteer to work, to learn more about this, but also to help out? Because he's really a great guy. She ended up becoming one of our hospital's main volunteers. And then she would advocate for these individuals, especially the young people, because she now understood the disease that he was going through, which I thought was fantastic. Do you get what we're talking about? Heck, there's people in our society right now that want those who have food issues to have to take a drug test to get food. Really? Really? We want to drug test individuals who economically are having an incredibly difficult time. And so let me ask you, what's the implication in the public perception of that? When you say, yeah, these people need to get drug tested to get assistance to get food or energy assistance, the implication is they're dishonest, they're bad folks, they waste money, they're not worthy. It's like, really? I know some of us sarcastically would say, I have an idea. Why don't we give the legislature drug tests before they start every session, right? I know that's sarcastic, but it's like, it's a political issue. Why do we make a disease a political issue? It doesn't need to be. It's a disease. So if you've listened to any of these podcasts that I've done, and I hope you have, and if not, I hope you will, one of the consistent themes when I interview people from especially your county, especially Kenosha County, our county, as Guido would have me say, is I need a job. Whenever I'm interviewing somebody from Kenosha County, if it's not during the podcast, it's exactly after. I need a job. Do you know anybody where I could get a job? Whatever. And it's like unbelievable. And I'll steer them in a couple places or whatever. And there's this, it feels like the Underground Railroad. I now have contacts who have a contact who has a contact. And so I'll start them on that road. One of the young women who I'm going to record this Sunday again, because I did before, has put me off 3 times. So we've had it scheduled to do another podcast 3 times, but she can't do it because now she's working 2 jobs. And she's working 2 jobs. She's so busy. And she's like, Mike, I'm so sorry, but I will do what I promised. I can't wait. She's great. She's honest. She's working hard. She's recovering, right? But what are the chances that she would have had with no income, no money, right? Now she's got 2 jobs and she's doing great. You've heard some of the podcasts about Oxford houses. Heck, it got so difficult. The people just started their own thing. Let's buy a house. Let's fill it with recovering people, right? And if we're full and there's too many of us, we'll start another one. They're all over the country now. Google them and you see where they're at. And it's just a bunch of guys. I went and had dinner there a while back. This is Guida, thank you. This is great. I get a meal. And it's just a bunch of people who are working. They just live together. Kind of reminded me of college, right? The furniture was better. Economically, policies are written that put folks who have substance use disorders at a disadvantage. So wrap it this way. I think it's important as part one of this discussion, not to solve all the problems in the world. That's not what this is about. What this is about is initiating a thought process and a discussion so that we can begin to say, what can we do as a collective group, as an individual, to have an impact in the way substance use disorders is perceived by the people that we interact with on a daily basis, right? The first story that I told you, what was absent in that story of the school, did anybody say, what can we do to help this kid with what he's going through? And for those of us who worked with individuals, predict the future. This is the last we're going to hear of him having chemicals and substances. The system of professionals, all with their own stuff, created a hole big enough to drive a truck through. And if I know my stuff, I think we'll hear about it again. And I hope we respond a little bit more therapeutically to what that individual needs. When we talk with other professionals, I think it's critically important as well. Sometimes I've been part of these discussions where people gather around and you hear stuff. And it's like, you would never say that in front of the person you're working with, right? Why are you saying it here? Do you view, as a counselor, the person with the strength, the courage, and the conviction to get better? Do we see people, do we honor their tradition? Do we honor their family history? Do we honor them? I can't tell you the number of times over the years that I've said to somebody, I cannot believe how strong you are. And they'll look at me like I'm the one with the problem. Like, what are you talking about? I have this problem, this problem. I said, and you're here. And you're here. Do you know how many people aren't here? Do you know how many people I don't get to see? Do you know how many people have not opened their eyes and said, I'm going through this, and sought help? Do you know how strong that makes you? They don't see it. It is up to us to guide some of that and those discussions so that in our agencies, in our counties, in our medical system, we begin to treat this disease the way it needs to be treated. I'll end it this way. I have a friend of mine who's a physician. I'm going to get this wrong a little bit, but I got the gist of it right. He said to me a long time ago that as a physician, in 4 years of medical school, he got 3 days of training in the number one health issue in the United States. And that's people's own usage of substances. That's what we're looking to change and have a discussion about. Okay, I'm done. That's 50 minutes of me just talking. So you're probably bored out of your mind. But I told Karen when we talked about this that I'd leave 10 minutes for you jumping in, having a discussion, making whatever comments you want, thinking about it as we go along or whatever. Tell me I'm off base, whatever. So be the first on the block to just pump in. Or how do we, I don't even know how we do this, so I can't do that. Guida does that, right?
You can unmute yourself and just ask a question. That would be great. You can type it in the chat if you don't have access to that, but.
Or make a comment or tell a story of your own. That's fine too.
Yes. And I hope someone will be brave enough to start off the conversation. It's usually the first person willing enough to speak starts and gets it going. Carrie?
Yeah, I can't keep my mouth shut. So thanks, Mike. I loved listening to everything. And so this is as I'm just listening to your stories and the specific encounters you've had, this is what I wanted to comment on. People ask me off, there's an opioid epidemic, or there's a substance abuse issue, or we don't have mental health, right? People, what can we do? What can we do? And it's politicians or other county officials or other human services workers in whatever capacity. And nothing is more powerful than a personal story,
Yes.
right? Because we can talk about data and facts and projections and forecast all kinds of things. And then it makes it not personal. And then no one wants to listen to it because, it's like the war in Ukraine. It's awful. You're listening, but meh, how is it going to affect me tomorrow during the day? I don't know. So you kind of just dismiss it. So that idea of folks having self-disclosure and recovery. And so I have this really mixed experience with talking with individuals that might be willing to share their story kind of on a larger platform, so hope and healing and recovery can be inspiring and made personal to our community. So what I would just wonder if you have direction on that or insight on that, Mike, on how how we can kind of tap into that to make that more powerful.
Tap into them telling their story.
Yeah, and to be honest, because we've talked about the conversation, and it might be me internalizing, but it's usually not an easy conversation for me to have with people. We've known each other now for a while. This person is asking for a story of hope and healing. And to be honest with you, there are times where the conversation doesn't go well. And then I think, did I ask the wrong person? Should I be looking for something else? And then I always think, well, it's not for me to decide. So I just want to present the opportunity.
It's I don't know if I'm even going to answer your question, but I thought of about 9 things as you were talking. First of all, I love the picture of the mushrooms in the background. That's
Thank you.
When people tell their stories, they change over time, depending on where they are. Like, I alluded to it. I had a hip replacement, right? If you'd have talked to me 20 minutes after my hip replacement, I would have told you a different story than I would have told you a year later, and what I would tell you now. So their story changes over time. Second, I think that their story needs to be told out loud to the people around them. Now, I'm going to upset people here. I know I am. But the whole anonymity part of this is sometimes hurts us a great deal. That, hi, I'm Mike M, right? And so we don't identify. I had a lady on the podcast a while back who was an attorney recovering. And I always ask the recovering people, can I use your last name? And most of them say, I prefer you not. Now, why is that? Why is that? I honor that. We honor that because they're doing us a favor by doing this, right? But I honor that because they're afraid of the backlash if they're identified. They're afraid of the economic consequences and the social consequences. Well, this woman was entrenched. She said, absolutely use my first and last name. I want people to know that it's not just down and out people. It's lawyers that have this too. And I want the lawyers out there that are listening to this to know that they have an outlet to go get help, that they don't have to suffer in silence. That's what she told me off the air. And so we used her last name with it. I like that, right? So I think that the more people who speak out, I totally agree with you. Those stories are critically impactful. You mentioned Ukraine. We're going through the same. Well, no, I'm not even going to mention this. I don't want to get off on that tangent. But the more personal the story, the more it's difficult for those people who control the funds and everything to argue with it, right? Think about all the stories. This is a safe one I think I can do. Think about all the stories you've heard about breast cancer survivors, right? And why is this one of the most donated charities in the world? Why do we have 5,000 people showing up for a run, all in pink, supporting, and tons of allies? It has nothing to do with politicians. It has nothing to do with funding. It has nothing to do with medical payments. It has to do with somebody is related to somebody, and it's a personal story. If you watch a Major League Baseball game, at the All-Star game this year, they do this every year. They have a moment of silence in the stands at the All-Star game where they give everybody in attendance a sign. and it's for cancer awareness. And they all hold up a sign who they're in support of. This is somebody in their life who's had cancer. And the announcers do it, the players do it, the umpires do it, the fans. It's incredibly powerful. You'll see people weeping in the stands at that moment of silence. And what happens to the research dollars? They go up. What happens to the stigma? It goes down, right? So I think as much as possible to encourage those people to speak out. And that's why the coalition had the idea of starting this podcast to begin with, that we do, is part of the reason for the podcast was break down the stigma, talk about stigma, make it more of a normal conversation. I hope that we've accomplished that in the 2 years we've been doing this, is to just have a normal discussion and a conversation about it.
I want to jump in here. So this year at Help and Hope, for those of you who can't see me, I'm Guida Brown. I don't know why I'm moving. Anyway, this year at Help and Hope, which is November 4th in Racine, 13th annual, the night before, Thursday night, we're actually going to show the anonymous people, a screening of the anonymous people, and then do a panel discussion. And if you haven't seen it, it was made about 10 years ago. And it's all of this stuff that Mike's talking about. It's all of the breaking down of the stigma and why people don't use their last names and how we have to get to a place where people are more comfortable using their last names because of society, because of the stigma, and how we need to treat substance use disorder as one of the people calls it this is our plague. This is our Black plague. And we need to start recognizing that and treat it like every other disorder, cancer and AIDS and all of these things that people have thought that we brought on ourselves. So November 3rd in the evening, again, this will be up at the Racine Gateway campus, and we'll be screening it, and it will be free, and you don't have to attend the conference to attend the screening and the talkback. But I just wanted to throw that out there because it's a great documentary, and I think too many people have not seen it yet, and we need to start talking about it again in the same way. So,
well, could you imagine, Guida? Could you imagine if the statistic came out that 40% of all individuals in a hospital today were there as a result of AIDS? Could you imagine the focus on it? But that's the way it is with substance use disorders. 40% of the people in general care hospitals are there today as a result of their using the chemicals. Now, they're not all in treatment. It's sometimes liver, it's sometimes heart, it's sometimes lungs. But that's how devastating and costly this is. And staying silent about it and not having it be an issue costs us all dearly. Well, this was fun. I enjoyed this. You're lucky you're on Zoom, because if we were all in person, I would be looking at you, making you feel bad about not saying something right now and asking your opinion. So we'll hopefully, maybe we can do that in August, have a long, person get together. We can rent a tent.
all right, Karen, I think we're done.
All right. Any last questions? Please don't be shy. We'd love to take this opportunity while you have it. All right. Thank you, Mike, so much. It was wonderful. And I look forward to the next one in August.
All right. Thanks. Thanks, everybody.
Thank you.